In this video, we will discuss about tumor lysis syndrome. This tumor lysis syndrome is mainly occur to the patients that are affected with cancers. So, what happens in tumor lysis syndrome is that the amount of tumor cells are more, and when they lysed, when large amount of tumor cell lysed in a short duration of time, that might lead to increase in the amount of potassium and the blood flow. In the blood flow, it will also affect the blood flow level in a way that the calcium content in the blood decreases because potassium will sop up some of the calcium that are present within the cells, and this process will follow. That is, purine nucleic acid will increase, and there are other things that is related to increase in the purine nucleic acid. And finally, what it will does is it will affect the allantotion, and this is the thing that will work against the cancer or the aging treatment. uh, the potassium will not take affect that much the calcium. The phosphorus will affect the calcium. I will correct myself. The phosphorus increase the lysis of the tumor cells will leads to increase in the phosphorus content, and that will soak up some of the calcium. So the calcium content in the blood will get reduced, and this will also affect the brain also, as calcium is also essential for the proper brain functional. And other side effects that might cause is it will affect various metabolisms that are going on within the body. And this thing usually occurs whenever a person takes a chemotherapy, traditional chemotherapy, or uh, even the traditional, even the modern therapies to treat the cancer, as in objective of both the therapies is that to kill the tumor cells. And when large amount of tumor cells kills in a short duration of time, that might lead to these kind of problems. And if this tumor lysis syndrome uh, remains untreated, that it might even leads to death of the individual. And in simple words, what is the chronology we will understand in this figure. It is cancer cells in the lymph node, and during the cancer treatment most of the cancer cell break down, and because of this the composition within the blood level changes, as this content will release in the blood. And what will happen in the blood is that the level of potassium that are present in the cancer cells will increase, and that will sop up most of the or some of the calcium. So the calcium content in the blood decreases. And what are the problems it might cause is that the uric content that has been suddenly increased within the body is sometimes more than the capacity of the liver to control that much concentration of the uric acid. So that might lead to kidney injury. And for those patients that are already that are that have that observe this tumor lysis syndrome and have this kidney problem, that might even cause more a severe problem to that individuals. And apart from these symptoms, it will also affect the heart rhythm, as the blood flow level and the blood flow composition within the uh, veins suddenly changes, suddenly or within a short duration of time changes. And that might also cause muscle cramp and weakness, or the seizure of the movement. And the patients that are more vulnerable towards this are basically have acute leukemia cancer, or they have high grade of lymphoma. So these two patients have are more vulnerable towards the tumor lysis syndrome. So whenever a cancer patient goes for a treatment, the best possible uh, way to prevent from tumor lysis syndrome is to have the blood analysis, the and to take care and to prevent themselves from the tumor lysis in advance, so that whenever such condition occurs, in the cancer affected patient, they will be ready with the treatment. So this is usually the case uh, observed whenever a cancer patient goes for a treatment, as their blood analysis will, or their cancer analysis will report will help the doctors to know the possibilities of having this tumor lysis syndrome after the cancer treatment. Or it is not possible that, it is not always the case that this tumor lysis syndrome occurs to the patient after the cancer treatment. It might also lead to happens to the patient before the cancer treatment because of the excess amount of tumor present within the body. And these are the two major conditions, two major types of cancers that have this excess amount of tumors. So that's all for this video. Thank you for your time.